Good afternoon and welcome back to a two-week sitting block for Parliament following the mid-year recess. Today I have both Minister Farfoy and Minister Hipkins with me to give an update on decisions made relating to RSC workers and efforts the government is undertaking to assist industries hard hit by worker shortages because of Covid-19. But first, let me give an overview of my coming week. Tomorrow and Wednesday I will be in Wellington in Parliament. On Thursday I head to Christchurch to attend the reopening ceremony for the YMCA's Hotel Give, following the YMCA hostel's seismic strengthening and refurbishment courtesy of the government shovel-ready funding. On Friday I'm in Auckland for a virtual Pacific Island Forum leaders meeting. With COVID still raging around the world, we'll discuss the Pacific's response and how to keep populations and economies safe. From today, I'll be providing a weekly update on our vaccination program. Last week saw a major milestone reached with the opening up of bookings to Group 4, New Zealanders 60 plus. It also saw the launch of Book My Vaccine and the 0800 number, which now means we can manage all booking nationwide rather than just by DHB by DHB. These changes have already made a real difference. Last week, we vaccinated over 250,000 New Zealanders, with 253,163 people receiving a vaccine, our biggest week to date. Friday last week was also our biggest single day of vaccinations. The mass vaccination event in South Auckland was a success, with 15,881 Aucklanders vaccinated over 3 days. We'll be assessing how it went and what we can learn from it for future events, given it was our first mass vaccine event. But we will likely see more vaccination events like this around the country over the coming months. The booking system is performing well. 345,734 vaccinations were booked last week, and over the last 3 days, 15,728 calls were handled by the 0800 call centre. Feedback has been that it's been a fairly seamless and speedy process, with average wait times of less than 1 minute on the 0800 number. 659,316 over 65s in Group 3 have now either had their first vaccination or are booked. That represents more than 80% of people in this group. We continue to encourage anyone over 65 who hasn't yet booked their vaccine to take up the opportunity to do so. And more than 60% of people aged 60 to 64 have either booked or received at least one vaccination. Less than a week into this group, that is a great result. Again, we urge any members of this group to book as soon as possible. Finally, we saw the rollout of more vaccination sites. Last week, 76 sites were onboarded and started vaccinating. This included a vaccination clinic on Rakiura, Stewart Island. That was a great success. Because of the island's isolated nature, the clinic was available to all residents aged 18 and over, and 257 vaccines were administered, more than 80% of the eligible population. As well as expanding our vaccination program, the government is also focused on supporting our economic recovery. COVID has closed borders around the globe, and New Zealand, like many other countries, is experiencing workforce shortages. Our closed border has been critical to keeping COVID out and keeping our economy running. Numbers out last week showed our goods exports rose 9.5% in the June quarter to 16 billion. Our agriculture sector led the charge with milk powder, butter and cheese up 31%, fruits up 33% and meat 13%. But despite these improved numbers, we know our agricultural sector is experiencing challenges. We've heard the call from primary sectors and others to bring in additional workers in a safe way, and we think that that is now possible. Cabinet has made the decision to work to open up one-way, quarantine-free travel to New Zealand from Samoa, Tonga and Vanuatu for RSC workers, without having to use the MIQ system. While there may not be travel from all three immediately, we're working towards this opening up in September. This policy will open up the ability for significantly more workers to enter the country to assist with an expected peak demand for workers in February and March of 2022. While we are currently bringing in 150 RSC workers every 16 days, this new one-way travel policy will significantly expand the potential workforce available for those experiencing labour shortages. will also have the potential to free up existing MIQ spaces set aside for RSC workers. Our intention is that any quarantine-free travel arrangements would be one way for entering New Zealand only. Travellers would still undergo quarantine on return to their home country, as has been their home country's policy. This expectation has been made clear to the countries that we are talking to. We are talking to these countries because the risk associated with MIQ-free travel is low. Tonga has had no COVID-19 cases at all. Samoa has had 1, and Vanuatu has had 4. All were at the border, and none have experienced community transmission. The government is aware there are significantly fewer temporary migrant workers coming to New Zealand than employers have traditionally had access to. While there are approximately 7,000 RSC workers currently onshore, there are normally over 10,000 onshore for the February-March peak. Some people here will go home before that peak, and there are also fewer working holiday makers here than in previous years. One-way quarantine-free travel for RSC workers will help manage that shortfall. We're already in conversation with the Samoan, Tongan and Vanuatu governments and will shortly be talking to industry bodies to confirm the details of the scheme. Minister Whāwhoi has had preliminary conversations last week with those industries most affected by this decision. We'll be working through some of the detail, including repatriation pathways, and one of the critical components of our agreement with these countries will be that they must accept RSC workers and enable their return so that we don't risk stranded workers. We'll also be looking for specific job opportunities and ensuring that we don't put at risk either country's COVID-free status. We're looking at additional health precautions to give added reassurance, both in the New Zealand side, and we'll be discussing with those we're working with whether or not there's further assurance on their side that may be required. And I would note that we're only opening up this option to specified workers at this stage so we can ensure that we can undertake it in a safe and managed way. This policy represents the kind of safe change to border settings we can undertake as a result of keeping COVID out. Further decisions on changes to our border based on our vaccination uptake has been the significant piece of work across government called Reconnecting New Zealanders to the World. A key piece of this work is scientific advice from Professor David Skegg and his committee of experts on the different levels of vaccination required in New Zealand in order to make safe changes to our border settings and what those changes may look like. On Thursday, August 12, there'll be a forum held here in Wellington where the research will be discussed, and I will set out how the government plans to respond to it over the next 6 months. Everyone wants our border settings to change, but no one wants to throw away our hard-won gains. I'll work to make sure we balance both demands. Now we're happy to take your questions.
How many workers are you expecting to come in under this new one-way travel bubble, and what are you doing to mitigate the risks? We talked about those precautions.
We're only able to do this, firstly because New Zealand has the position it has where we are COVID-free, but also because those Pacific Island nations that we've chosen to work with are also COVID-free. But we are working on extra assurances, things like pre-departure testing, on-arrival testing, and some mitigations at the early period of their arrival alongside their employers to ensure that we do indeed have COVID-free workers.
What about the numbers that you're expecting to come in?
Well, at this stage, our goal is to ease the pressure with the horticultural industry. So we'll be working closely with industry to make sure that we are achieving that goal, taking some of the pressure out, making sure that we're not having fruit rot on the grounds, meeting the demand that we know is coming, particularly into the first part of next year. So Minister Whāwhoi has been having discussions directly with industry, so I might have him speak to that as well.
Yes, so we met with the sector last Thursday, I believe, and they've obviously taken the news very well. There is some work to do with them in terms of capacity of what they are able to bring in through when we're able to begin the quarantine-free travel, but they are keen to work with us to make that sure that they do have sufficient numbers for the next season.
So this is just one of the many issues that have been thrown up by the closure of our borders. Will more border exemptions follow?
but we're working on those issues as we speak. Obviously, with the likes of split families, etc., it's about getting the balance right and making sure we do have managed isolation capacity to make commitments in that area. We are very happy that we're able to make sure we meet the demands of the hort and vit sector. Obviously, they had troubles with being able to access sufficient labour last season. We've been talking to them every fortnight for the last 6 months to make sure that we're aware and they're aware of what moves we're making, and it was nice to be able to give them some good news.
Prime Minister,
Sorry, I was just going to add, this is actually a decision that we can make that doesn't jeopardise New Zealand's hard-won status, but at the same time doesn't impact on those New Zealanders who may be offshore and seeking to come through our managed isolation facilities.
In terms of timing, did Cabinet sign off on that today, and why have you chosen to announce that today?
No, actually, we signed off on this, it would be a couple of weeks ago now. We've been doing some, of course, once Cabinet made the decision, we needed to start some initial conversations with those countries who we would be working alongside. But now we're at the point where we do need to start moving along those talks. That's the point at which we wanted to make it public, because we will start holding more conversation with industry now.
Why now? Why today, though? Why not wait till those talks are finalised?
Oh, because simply we'll be talking to a wide range of individuals and stakeholders. And once we start doing that, of course, at that point, these conversations often will reach to the public domain. It's the point now for us to share it publicly. We've made the decisions a few weeks ago. We've started the work. That work is ramping up. And now we're in a position to share it. I'll come to Jane and then I'll come to Derek.
What about people in other categories, including in medical categories?
Yes.
At the case we've been reporting, the guy in Singapore cannot get an MIQ spot guaranteed. What emergency provision is there for people like him and indeed his sister? And is it acceptable that this man is waiting in Singapore?
Okay, so I'll split it into two parts. So the issue of those who may, for instance, be in a country where we've made a decision that we can bring quarantine-free individuals within the REC scheme in. In principle, Cabinet are of the view that if there are those in emergency medical situations in those countries for which we're accepting REC workers, that we would be willing to consider allowing emergency medical situations where that travel could be quarantine-free. We want to, however, first establish the system, get the health settings right and the assurances right. So that's the process we're going to work through, but in principle, Cabinet did take a view that we should be in the position to support those who have health circumstances. For the issue of Singapore, I'll have Minister Hipkins just respond to the case that you've raised.
We have 350 rooms each fortnight available for emergency allocations for people who have a desperate need to come into New Zealand for whatever reason, and that does include some medical grounds as well. I have been discussing with officials, and we'll get some more advice in the next day or two, on people who have to travel out of New Zealand for medical, critical medical procedures that aren't available in New Zealand. That's a very small number of people, but we will get some more advice just to make sure the settings are right on that. But where there are people who need to get back into New Zealand, time critical, there's 350 rooms available a fortnight. Probably what I would observe, though, is that we are seeing examples where people don't give us as much information, or don't give the people processing those applications as much information as they subsequently share if their application is declined. So my request to people is put as much information as possible in your applications, because there have been examples over the last year where people have been declined an emergency allocation. They've then shared a whole lot of information publicly, which has prompted us to review that, and that was information that was not available to the people making the decision on whether or not to approve them in the first place.
Is there a straightforward process where someone in an emergency situation, or in a time where you can't work around timeframes necessarily, it's an emergency and the situation, that they can easily get hold of someone and go through it?
Because this is someone who hasn't actually made an application to come back because they're not sure when they will yet. Is that my understanding of the case?
Part of it around is the timing and having to make it. But I suppose for people who aren't always going to fit into a slot or a category, is it easy to ring up for these exceptional circumstances and talk to someone and say, this is the situation I'm in? Because a lot of the frustration seems to be actually joining the two up?
So there is a process, and we do ask people to provide written information because, of course, we need to verify the information that they're supplying if they're asking for an emergency allocation. As I said, there is one group where I'm just checking to make sure that we've got it absolutely right, and that is people who are in New Zealand now but need to travel in order to have some essential medical procedure that they can't get in New Zealand. That is a small group, as I've said, but I just want to make sure that the settings for them are right.
Is the Ministry of Health high-cost treatment pool patients?
Well, that could be one of the groups of people that are covered by that. Yeah.
But, I mean, David Willett specifically, can the government help him in this specific situation? I know there are lots of individual cases, but this seems like a case where, you know, he really should be given some help and assisted to get emergency MIQ to come back.
Yeah, I've always taken the view that I don't publicly discuss individuals' cases, particularly not where I haven't been in communication with them and therefore don't have any consent to speak on their behalf or to share their personal information publicly. People choose to share their own information publicly. I've generally not responded to that, but we do have systems in place to review individual cases, and I'd encourage people to go through that process.
Yeah. And keep in mind, you know, we've kept those 350 places a fortnight for the circumstances that are often described, real emergency situations where people do have genuine need. But the reason, of course, the stories we have now are coming to the fore is because there is considerable demand for people to come back, even though we actually accommodate the equivalent of a small town in New Zealand every single fortnight in managed isolation, 4,000 people. And so it is a significant group at any given time, but there is a lot of demand right now, and that's why we're seeing these stories come to the fore, where previously we were criticised for the fact that there were empty rooms because New Zealanders weren't using the demand that was available.
Just to follow on from that, is it a demand thing, or is the system just too inflexible?
Demand. Obviously, these issues don't arise when we have the same, demand and supply. There are peak points where, for instance, during April and May, we had capacity. The minister at that time urged New Zealanders who may need to return home to come in at that point because we could already see some hefty demand in the system down the track. Another important point, we have not yet released all of the space available for instance, November. We don't release every single room available right through to the end of the year. They are released in batches because if someone has an emergency need, say, come up in August to go in November, that they have a fair chance of being able to access spots rather than those who knew they needed to travel early on. But one thing the Minister is looking at is whether or not there are settings changes that will make the system fairer. So he is examining some of those options because we hear some of the issues with, for instance, withholding some of those vouchers. I'll let you finish there, Derek.
I just wanted to ask about the RSE workers. The last year you brought in 2,000 on the condition that they could pay the living wage. Is that going to apply again this year?
Yeah, so all of those conditions still apply.
Minister, just while we're on
We're also always very aware of accommodation, welfare needs, and those are things that we've always worked with industry on to be assured of when we're bringing in RSE workers.
How many workers are expected to come in?
Yeah. Well, look, on that, Barry, we don't have an exact number at this point because we've only just started the formal conversations with industry. That conversation started on Thursday, and now that we have the decision in the public domain, we'll get into some more of the detail. But as I've said, 7,000 currently onshore, there's normally 10,000, and that doesn't take into account how many may depart between now and some of the peak periods in early 2022. But we'll work through with industry. Some of the constraint will be their ability to return home. There's limited capacity in the managed isolation facilities for Samoa and Tonga and Vanuatu, so we'll need to work with those countries to be assured that once they have completed their work, they're able to return, because we have had distressing situations where RSE workers have not been able to go home when they wish to. Henry.
Prime Minister, you're talking about using the workers as kind of a test case here for you can have people coming with medical reasons and stuff.
Yep.
Is it your in-principle decision to eventually allow normal travel, family members who live in Tonga?
Not at this stage. The in-principle extension at this stage, once we're comfortable with the arrangements that were established, is critical healthcare need, and those who may, for instance, have for instance, scholarship to come into New Zealand for long-term study. So not coming and going, but to come into New Zealand for long-term study. So those are the in-principle decisions. One of the reasons we haven't gone beyond that is because of the fact that you would then run the risk that people come into New Zealand and are stranded, because there's not that flow of people two-way.
The wage requirement, how is the government actually requiring that? And do you have a Labour inspectorate basically watching and making sure?
I'll have Minister Barfoot will speak to that.
Look, to be perfectly honest, while there was some discussion about that at the time with the sector, I think they realised that in a constrained time of labour that was the right thing to do. Again, we haven't had detailed conversations with them. We just gave them the rough outline of what we're trying to do in terms of discussions with governments last week. We'll continue to do that as those talks progress.
New Zealand's quite a lot of wage inflation in the last year or so. Do you expect that wage inflation might be a little bit inflated by this decision?
No, I don't expect that.
Do you agree?
Yeah, I'll come to you, Dana.
Do you
and then
agree?
I'll come to you, Ben, and then I'll come to Bernard.
Plenty
Plenty of time, everyone.
Do you agree with the Human Rights Commissioner that the government is failing on the basic human right to a decent home?
Well, actually, what I heard them also say is that we had made, steps towards, of course, housing provision, and they acknowledged the work that we had done. But it is ultimately their decision. They are an independent body. It is absolutely their decision to inquire into any subject matter that they choose. I, for one, have frequently said that I believe everyone should have access to a warm, dry, affordable home. And all of the work we've done on extending and retrofitting homes to ensure they're insulated, healthy home standards to make sure landlords are insulating, building more houses than any government since the 1970s and record consents have all been because of that belief. If the Human Rights Commission choose to do an inquiry, that is their prerogative.
Do you agree that the housing crisis is a human rights crisis?
Well, I believe we have a housing crisis, and everything we've done as a government has been an acknowledgement that we need to act, and we need to do what we can as government, and of course encourage as much activity and support as much activity in the private developer sector as we can, because we believe everyone deserves a warm, dry, affordable home.
You don't see it as a human rights crisis?
You can call it a housing crisis or a human rights crisis. It needs to be dealt with. And we have long acknowledged that we do have a housing crisis in New Zealand. We do. Everyone should have a warm, dry home. That is not currently the case, and that is why we have put all of the energy we have as government into this issue.
Minister, on the announcement today about...
I don't mind what label you put on it. A crisis is a crisis.
Prime Minister, on the announcement of the one-way bubble, does this indicate that the overall review of migration settings, which was supposed to be tightening, that may not be the case anymore?
Sorry, go through that again.
So the overall review of migration settings, how does this fit within it? Does it mean that it won't be quite so
Well, actually, right at the beginning, when we set out the work we were doing on immigration, we always said that REC would remain as a policy for New Zealand because it actually is part of our development work with the Pacific as well. And so we were clear on that from the beginning, that was one area which we would see continuing as we were doing the work on our immigration settings.
And is the government considering a widespread amnesty on residency for those people who are here on temporary visas and apply?
We haven't made any decisions in that regard, but what we did do when it was asked of us quite some time ago, actually, as part of the consideration of an apology around the Dawn raids. At that time, we heard different calls from different sectors to consider amnesties. We've said we didn't believe it was appropriate to make an ad hoc decision, but rather any consideration of such issues should be part of our wider immigration review work that is underway, but no decisions have been made.
Minister Hipkin.
I'll go Ben, and then I'll let the question go to Minister Hipkins.
On the Dawn raids yesterday, which was obviously quite moving, if they're important enough to apologise for, why is it not central enough to make a mandatory part of the school curriculum?
Because we, of course, allow schools to develop elements of their curriculum. So whilst we're, of course, requiring all schools to teach New Zealand history, there'll be elements within that that will be localised and decisions that will be made by schools. Already some schools do teach the Dawn raids, but one of the issues that they've raised is they don't always have enough supporting material. some of the work that we're going to do will mean that there are resources now that schools can draw on. Helpfully, the Minister of Education is here, though, and he may wish to speak to that.
Don't have a huge amount to add to what the Prime Minister has said, but schools, of course, are very enthusiastic about the New Zealand history curriculum and the ability to pick up a variety of different events that are significant in New Zealand's history. That can include some more recent history. So I think there's almost an impression out there that we're talking only about early New Zealand history. Actually, we're talking about New Zealand history right up to the contemporary, and that includes things like the Dawn Raids.
Prime Minister, you were lobbied quite directly by some of the speakers, including the Tongan Princess, to consider amnesties more seriously. Has that weighed upon you, the gravity of yesterday?
Well, as you've already heard me outline, that has been a call that very early on, when there were questions over whether or not the government would or should apologise for the Dawn Raids, that question of the status of overstayers was raised some time ago. And so I've already set out for you our view that any consideration there needs to be more broadly considered.
Yesterday, really bring it home to you.
Oh, I guess the point I'd make is any time it's raised by me, by a member of the community, I give it that due consideration. And we have, and our view is that it needs to be part of a wider piece of work. One thing that may not be known is, of course, the last Labour government in 2001, in 2001, did undertake a piece of work on pathways to citizenship to support those who may not have legal status to go through the process to have legal status at that point. So there has been a point in the immigration program where there was a amnesty of sorts, but it was some years ago.
Minister, on the vouchers,
Toba, I'll let you finish that supplementary.
Thank you. That was coupled with the tightening of immigration settings back then, wasn't it? Which is something that you're looking at doing. So it seems like it could be something, because in the past I feel like you've poured cold water on the idea of a pathway to residency for people who have overstayed.
What I wanted to do was keep in check expectations that it would be a part of that apology, because as we've outlined, our view is it needed to be considered amongst all of our immigration settings.
Door for it to be part of the immigration research.
Oh, I've said no decisions have been made. We didn't think it appropriate to make an ad hoc decision without considering the wider ramifications. So that's where that sits now.
Minister, on the MIQ
Okay, I'll let you take a question, Minister.
Minister, on the MIQ voucher system, there's growing pressure from expats and also New Zealanders here who rely on work overseas. When you designed this system, did you expect it to be this hard?
What we've seen with MIQ is we've gone through different phases. So we initially had quite a high degree of demand, and we were just managing our demand and managing our way through that. And then, of course, that demand started to turn down, and it looked like we'd got on top of that. We've then seen demand turn up again, and it happened quite quickly. Literally within a space of a week or two, we went from having thousands of vouchers available to having next to no vouchers available. The MIA system, the Managed Isolation Allocation system that we have at the moment, works well where supply and demand are roughly evenly matched. Where there is more demand than supply, it can be challenging. And so we are having another look about how we could ensure that we're getting fairness in that system. So, for example, the speed of someone's internet connection, advantages and disadvantages some groups. So we'll look at a variety of different things there.
So are you saying it's not fair at the moment and you'll look to make some changes?
There are certainly some equity issues there and issues of fairness, and we want to make sure that we're looking really closely at that to make sure that everybody's getting a fair opportunity to get a chance to come back to New Zealand.
You were feeling left out and locked out. Do you feel that pressure?
I guess I stood here 4 or 5 months ago and said, look, we've got space available. Now is a good time to come home if you're a New Zealander abroad who needs to come back into the country. And so there has been opportunity for New Zealanders to come back. Of course, I feel for New Zealanders who are finding themselves somewhere else around the rest of the world and want to come back to New Zealand. That is a reality in a global pandemic. Travel is going to be difficult. It's going to be expensive. It's going to involve delays and disruption. And therefore, people should grab whatever opportunities they can get.
If we could say, New Zealand's a small country. We'll know people who will want to return home. And I want every New Zealander who's currently abroad, who has a desire to come home, to be able to do so. However, I want them to come home to a safe New Zealand. And our managed isolation system has been what has kept New Zealanders safe. So we constantly have to strike that balance between safety for them and their families, but also allowing people to come back.
Equity issues by?
Yeah, so some of those issues are being worked on now.
That's right. So obviously, first of all, I want to be very clear. We're not going to change the bookings for people who already have a booking. So what we'll be looking at is, as we release more space, future space, are there additional things that we can build into the system to ensure that there's, greater fairness and equity there? As I said, up till sort of a couple of months ago, we had a situation where we weren't getting demand for emergency allocations because people could just jump online and book a room at short notice, and that just changed very quickly.
When are you going to fix the unfairness by?
As quickly as we can. We're working on. I've got some options coming. I don't want to put a particular time frame on it. I'd imagine it would be within 8 weeks we would have more to say on that.
New Zealanders who are stuck overseas.
Oh, it's a question, the question of a wait list. We are also concerned that in some cases, sorry, I just thought I'd pick up Mark's and then I'll come back to you. In some cases that also poses issues as well because of, as I said, some people will have genuine emergency needs that mean they suddenly need to travel. They wouldn't have been able to put themselves on a wait list, but with the system we have at the moment where you see regular releases, it gives them an opportunity as well. So no matter what you do, there will be in some way an issue that creates for somebody. So it's something we're constantly trying to balance.
One of the challenges with a wait list too is making sure that you're matching up timings in terms of when people want to return, the availability of rooms and the availability of flights. For some places around the world, actually flights are very difficult to get at the moment, and there's often quite a narrow window, and making sure that we're matching all those things up is a huge logistical undertaking.
Because if we release vouchers that have no alignment with flights, then that means those individuals have no chance of coming back. So we do release them with flights in mind. Yes, sorry.
New Zealanders who have been stuck overseas for more than 6 months are now reporting that their pensions are being cut. Is that fair, and is the government going to do anything to address that?
So the question I'd ask is, where have they been stuck for more than 6 months? Because, of course, in April and May, we had capacity in MIQ. We've actually done some analysis with MSD over those countries where people have been drawing down pensions and or their benefits, and for the most part they have been countries where there have been free movement and availability to come back to New Zealand. However, New South Wales is an example someone's put out. In those circumstances, that is beyond their control, and I would ask that individual to make contact with Work and Income because they should not have their support cut off. That is a particular set of circumstances where, yes, they have been genuinely stuck and should continue to be supported.
And on that urgent the urgent order for syringes, can you just confirm how many have actually been ordered in and how long the current stock is supposed
That story is wrong. I'll have Minister Hipkins speak to it.
There is no shortage of syringes. We have more than enough syringes for the vaccination campaign. Of course, like all health supplies, there are international supply constraints there, but there is absolutely no concern around the availability of syringes. We have plenty of syringes to be able to be going on with our vaccination campaign. And that includes a variety of different types of syringe as well. So when you're extracting the 6th dose, they'll often use a different type of syringe to the first 5 doses in order to maximise what we were able to get out of each vials. In the early part of this, when we were looking particularly at that ability to extract the 6th dose, there was some concern that we wouldn't have enough, I can't remember what the exact term is, the low something space syringes, and we ordered plenty at that time to make sure that wouldn't be an issue.
My understanding is that story was based on the fact that we had a request for quotation. We were seeking quotes on different brands and syringes for ongoing contingency planning. We already have enough orders in place to cover our vaccination program already.
Was part of the contingency planning around product stewardship with what's going to be happening with the medical supplies that are coming in with vaccinations? Because obviously there's going to be a lot of waste generated from this. Is there a plan in place
for product stewardship around waste for consumables? Yeah. Forgive me, it's a good question. Well, not one I can answer though. But
no, look, we're happy to get some more information for you on that. I know that medical waste, if you like, has some interesting challenges around it, but I'll certainly get back to you on that.
Yeah.
Back on the temporary.
Same question could be asked for masks and PPE globally.
Back on the call for.
Yeah, I'll come here and then I'll come.
Back on the call to grant residency for temporary workers, why don't you want to do that?
Okay, so you will have seen that we've already taken a decision as Cabinet on those individuals who have been on temporary visas to ensure the rollover of those temporary visas for 2 years where they are in areas of work where we would otherwise be seeking workers into New Zealand. It just makes no sense to be seeking a workforce offshore for those who are already here on temporary work visas. We're now seeking advice in a similar vein to those who have put in residency applications. I've heard in particular from the likes of the agricultural sector who may have workers here now who are actually seeking some certainty about their future. And we agree we need to try and expedite some of that decision making. So we're seeking some advice on that.
What about the expressions of interest queue? Apparently it's been closed for some time. Minister Farfo, you've possibly had advice on it since April, but are yet to make a decision. Meanwhile, doctors and software engineers are leaving the country.
Yeah, that's some of the advice that the Prime Minister is alluding to. We want to make sure that we are making decisions like that in concert with some of the wider decisions we might have to make around the settings for our residence program. So again, it's not we don't want to make decisions in isolation. It's about gathering all the issues that we want to deal with, and we're getting advice on that at the moment on the wider sector.
My view is that we'll probably have something to say on that fairly short order. So this is not something I see taking months. I see decisions being made sooner than that. We prioritise making those decisions for people on temporary visas so that they could do some planning. Next in the queue is those who are in country with residency applications.
So what sort of scale are we looking at?
If I may, I've just got a little queue going here.
There's some confusion about those proposed conversion therapy changes. Just to clarify, could a parent be breaking the law if they stop their child taking hormone blockers?
Look, I made it very clear on the weekend that the purpose of the bill is to make sure that we're having open discussions and responsible discussions about conversion practices, especially with young people and vulnerable people. The way that we have designed the system isn't targeted towards criminalising anyone. It's about making sure that we give the ability for those discussions to have. There's a very long process before anyone would see the inside of a courtroom, and that includes getting the consent of the Attorney General as to whether or not the public interest test has been met to take a criminal case. We don't want people to be criminalised about this. We want the harm that is being done by conversion practices, which there is strong evidence that is happening, and the fact that the conversion practices don't work to be the main purpose of this bill.
Just on the residency, what sort of scale are we talking about in terms of the numbers of people who could get residency if there was an amnesty, and what sort of time frame are we looking at?
That is a wild hypothetical. No decisions have been taken, so that's not a level of detail I'm in a position to provide, and it is a hypothetical at this stage. Yeah, I'll just check who hasn't had questions, and then I'll look to wrap. Yeah.
Greyhound protection leagues,
yes.
dozens of dogs died on Kiwi racetracks.
Yes.
Last year, hundreds more are killed for other reasons. Your government was due to have an animal welfare report into the industry come back yesterday. What does the report say?
You'll have to forgive me, Ben. I would like to confer with our Minister for Sport before I give you a final answer on that. So you'll forgive me if I just take a little bit of time. Perhaps I can come back to you tomorrow on the caucus run.
The industry?
I want to make sure that we uphold our reputation as a country that takes seriously animal welfare issues, and that's why this work is being done in the first place. Yeah, look, I'll finish here.
Prime Minister Vanessa.
Oh, no, actually, I was looking behind you. Forgive me.
I was just going to ask on housing as a human rights issue. Will your government commit to implementing the Human Rights Commission's guideline?
It's guideline.
Guidelines released today.
Yeah, well, they're obviously undertaking their own inquiry into housing. Our view is that no further work is required to tell us that New Zealand, over a number of years, has worked up to a housing crisis, which we now, as a government, are investing billions into both making sure we have the infrastructure and also the government build program to address what is, in our view, a crisis. All right, thank you, everyone.